Level 3 curriculum is for all school staff who will assist students with diabetes in the school setting. The national language for identifying this person is unlicensed assistive personnel. This can include teachers, coaches, health assistants, educational assistants, and all school staff members who have responsibility for a student with diabetes when the school nurse is not on site. Level 3 training builds on the information received in Level 1 and 2. Covered in Level 3 module are social emotional issues, school responsibilities under the law, delegation by the school nurse, diabetes care task, and diabetes resources. Students with diabetes must deal with the usual developmental issues of growing and also learn to manage this complex disease. Be aware of the student's feelings about having diabetes. Many feelings happen with this new diagnosis. Other feelings may be constant, occasional, or happen years later during stressful times. Diabetes management requires a huge change in lifestyle for the student and the family. This includes grieving the loss of how it was before the constant 24 hours a day, 7 days a week challenging demands of diabetes care. Some of these emotional responses to diabetes may include shock or disbelief about being diagnosed with diabetes. Why me? Denial about the need to take care of diabetes. Anger about having diabetes. Depression and sadness. Fear about the future, such as developing complications or sudden drop in blood sugar. Anxiety about the day-to-day care and being different from peers. Feeling stressed and overwhelmed about diabetes information and care. Conflict within families over independence issues. Guilt parents and students may feel about the diagnosis and sense of loss of normal childhood. There is increasing awareness of depression in young children and teens, especially with diabetes and other chronic conditions. Often depression is not recognized, diagnosed, or treated. The following emotions and behaviors are examples of what you might see or might be told by someone who is depressed. Sad, anxious, or empty mood. Feeling hopeless and discouraged. Feelings of guilt, worthlessness, helplessness. Loss of interest or pleasure in activities and hobbies that were once enjoyed. Decreased energy, fatigue, being slowed down. Difficulty concentrating, remembering, making decisions. Sleep problems, early morning awakening or oversleeping. Appetite and or weight changes. Restlessness and irritability. Thoughts of death or suicide attempts. An evaluation for depression is recommended if 5 or more of these symptoms are present every day for at least 2 weeks and interfere with routine activities such as school, self-care, or social life. Remember, when children and teens are depressed, it can look very different than in adults. You may see an increase in restlessness, irritability, anger, acting out, and/or risky behavior. Students react differently to having diabetes. They may be accepting, resentful, open to talking, or wanting to hide it. Often the same student will experience all of these feelings over time. School personnel can help. Be aware of feelings the student may have. Provide encouragement and understanding. Build on the student's strengths. Provide positive reinforcement. Focus on what they do well. Encourage positive health behaviors. Observe for changes in behavior and communicate with the school nurse, care team members, student, and family. Respect the student's right for privacy about their diabetes. Remember, take care of yourself. You may have emotional responses while providing care for the student with diabetes. Talk with your school nurse or other diabetes care team members about your feelings. The school nurse will provide you with Section 4, School Responsibilities under Law, developed by the U.S. Department of Education for the National Diabetes Educator Program Guide, Helping the Student with Diabetes Succeed. This section provides an overview of federal laws that address schools' responsibilities to students with diabetes, including confidentiality requirements. You may wish to review this handout now. New Mexico has a state rule titled Diabetes Management for Students in the School Setting. This rule applies to all students with diabetes enrolled in public, private, home, or parochial school in New Mexico. The goal of the New Mexico Administrative Rule is to guarantee that all students with diabetes are educated in a medically safe environment and have the same access to educational opportunities as their classmates. The objectives of the rule are: grant students the right to self-manage their diabetes care in the school setting, and develop mechanisms that support safe diabetes self-management. Delegation is a tool that can be used by the school nurse to train school staff, referred to nationally as UAP or unlicensed assistive personnel, to assist a specific student with a specific diabetes care task. The New Mexico Nurse Practice Act defines delegation as the transferring to a competent individual the authority to perform a selected nursing task in a selected situation. The nurse retains accountability of the delegation. All people receiving instruction in diabetes management care tasks require adequate preparation and supervision to perform their duties in a safe and appropriate way. The student's Individualized Health Care Plan, or IHP, will identify the staff that are trained and the specific tasks that are delegated. Doing the job competently and safely when performing diabetes care tasks means doing the task as trained, saying no to tasks for which you are not trained. Remember, each task is student-specific and is delegated by the school nurse or other designated registered nurse or clinician. This is accomplished by the following steps. Number 1. Complete the Level 3 Diabetes Management Training. Number 2. Read and understand the handout, Actions for the Unlicensed Assistive Personnel. Number 3. Demonstrate competence to perform the specific task. Number 4. Ask directions if directions are not understood. Number 5. Follow directions from the registered nurse. Number 6. Follow established protocols and guidelines. Number 7. Communicate concerns promptly to the registered nurse. Number 8. Report observations and activities to the delegating registered nurse. Number 9. Document the care given. In order to perform diabetes care tasks, the following steps must be completed. The 3 PowerPoint presentations on helping the students with diabetes succeed, a guide for school personnel, and hands-on instructions in the diabetes care tasks described in Level 3, and return demonstrations by you of the diabetes care task until both you and the school nurse are comfortable, and a plan for rechecks and supervision throughout the school year determined by the school nurse. Unlicensed assistive personnel may receive education in one or all of the diabetes care tasks. Each task is independent and student-specific. Delegation of diabetes care tasks happens only after the completion of these steps. Stop. Review this handout with the school nurse. Actions for the unlicensed assistive personnel. The diabetes care tasks are standard precautions, blood sugar checks, recognizing and treatment of high and low blood sugar, ketone checks, both blood and urine, carbohydrate counting, insulin administration, and glucagon administration. The learning objectives for each of these are why the task is done, when the task is done, and how the task is done. How the task is done is covered with the school nurse at the stop signs. The school nurse will provide more detailed information, demonstrations, and practice when delegating any of these tasks. We will begin by reviewing the frequently used terms you will hear throughout this program. Glucose is sugar found in the blood which fuels body cells. Carbohydrates are foods that become sugar and are used for energy in the body. Glucose tablets or gel delivers a pre-measured amount of pure sugar. These are used to treat low blood sugar. Quick-acting glucose or sugar are foods that raise blood sugar levels quickly, such as table sugar, syrup, honey, and fruit juice. Glucagon is a hormone given by a shot during a low blood sugar emergency to raise the level of sugar in the blood. Hyperglycemia is a high level of sugar in the blood. Hypoglycemia is a low level of sugar in the blood. Ketones are chemicals that the body makes when there is not enough insulin in the blood, and the body must break down fat for energy instead of carbohydrates. Ketone testing is a process for measuring the level of ketones in the urine or blood. Diabetic ketoacidosis, or DKA, is the buildup of ketones in the body that can lead to illness and coma. What about blood and needles? Blood sugar checks do not present a danger to other students or staff members when there is proper disposal of lancets and other materials that come in contact with blood. Standard precautions are good hygiene habits. Examples of standard precautions are washing hands after a student encounter and wearing gloves when coming in contact with blood or body fluids. Employees are expected to use standard precautions with all potential exposure to blood and/or body fluids. If a blood spill should occur, clean the work surfaces according to your employer's exposure control plan. An exposure control plan is designed to eliminate or minimize employee exposure. Remember, if it's wet and not yours, don't touch it. Wear gloves. When the student independently manages their diabetes at school, they are responsible to: number 1, make a plan for safe storage and disposal of sharps with the school nurse. Number 2, have in their diabetes kits materials for absorbing any blood. Number 3, report any blood contamination to school staff for cleanup. This is in compliance with federal OSHA regulations. Blood sugar checks are done to help the student in making healthy decisions. Checking blood sugar levels is sometimes referred to as the cornerstone of diabetes management. Students with diabetes must check their blood sugar levels throughout the day. Many factors can cause changes in blood sugar levels, such as eating, exercise, stress, injury, illness, insulin, and other medications. Blood sugar checks can help. Make correct insulin dose decisions. Make a decision for prompt treatment to correct high or low blood sugar levels. Explain behavior changes that can occur with high or low blood sugars. Provide safe management of preschool and early school-age children who may not know their signs or symptoms of a low blood sugar. Observe trends so that changes can be made in medicine, meal plans, or exercise. Keeping blood sugar levels in target range supports learning and school success while decreasing the risk of school emergencies and long-term complications. Blood sugar checks are performed according to the student's medical orders and as written in the individualized healthcare plan. Regularly scheduled checks include before meals and snacks and before, during, and/or after exercise. More frequent blood sugar checks may be needed for the following reasons: times of stress or illness, when low or high blood sugar is suspected, when there are changes in medicine doses, exercise, or nutrition, and for safe management of students who do not know or recognize their symptoms of low blood sugar. When talking about blood sugars, remember to say blood sugar checks instead of blood sugar tests. Tests can cause stress. No matter what the results of the blood sugar check, checking the blood sugar is good. Talk about the results or numbers as in range or out of range, in target or out of target, and below target or above target. Avoid using judgmental terms like cheating, noncompliance, good, or bad. Keep in mind the student's individual target range as stated in the Individualized Healthcare Plan or Diabetes Medical Management Plan. Not all students will have the same target range, and the target range may be somewhat different at different times of the day. The school nurse will provide more detailed information, demonstrations, and practice if delegating this task. Stop. How to perform blood sugar checks will be taught by your school nurse. Review these handouts: Blood Sugar Monitoring Fact Sheet, Procedure for Blood Sugar Monitoring, Blood Sugar Blood Ketone Monitoring Skills Checklist, and School Health Office Diabetes Record. Recognizing low blood sugar symptoms is the best way to prevent an emergency. A low blood sugar is more likely to occur before lunch, at the end of the school day, or during or after physical education classes. Causes for a drop in blood sugar can include too much insulin, not eating enough food or having a delayed snack or meal, extra physical activity, exercising longer and/or more intensely than usual, or illness, especially if there is a loss of appetite or vomiting. There are 3 ways to identify low blood sugar. Number 1, a blood sugar number that falls below the target range. The fingertip should always be used if a low blood sugar is suspected. Number 2, what the student tells you. How do they feel? Some students don't recognize signs of low blood sugar. And number 3, what you, the caregiver, sees. Low blood sugar can be identified by 1, 2, or all 3 of these considerations. Low blood sugar unawareness happens when someone doesn't recognize their blood sugar is low. Generally, young students are not aware of their low blood sugar because they are not able to pay attention to the messages their body is giving them when their blood sugar is going low. The student with low blood sugar unawareness may need more frequent blood sugar checks. Any student who has had a low blood sugar during the day is at risk for another low blood sugar. Check blood sugar if a student has not checked blood sugar and has symptoms. Low blood sugar may be mild, moderate, or severe. What the student tells you and what you see differs from person to person. It can be different each time the student experiences low blood sugar. In mild low blood sugar, the student may tell you that they have a headache, feel dizzy, shaky, or are extremely hungry. They may also say their heart is pounding, their eyesight is blurry, or they have numbness around the lips. You may see that their skin color is pale and they are sweating. The student's personality may seem changed. They may appear anxious or drowsy. Mild low blood sugar can usually be treated easily and effectively. As soon as low blood sugar is recognized, treat the low blood sugar according to the emergency care plan or individualized health care plan. Remember, never leave the student alone, never send the student to the health office alone, and treat promptly with fast-acting sugar. In moderate low blood sugar, the student may have difficulty answering questions or problem solving. They may report difficulty focusing their eyes and/or have ringing in their ears. They may look uncoordinated and act uncooperative. If the student is uncoordinated and/or uncooperative, it may be difficult to persuade them to drink juice or chew glucose tablets. Glucose gel may be the quickest way to get sugar into the body. The caregiver may need to assist the student with the gel. Remember, do not attempt to give the student anything by mouth if they cannot swallow safely. If not treated promptly, a mild or moderate low blood sugar can develop into severe low blood sugar. With severe low blood sugar, the student may have difficulty swallowing, have a seizure, or become unconscious. This is a medical emergency. Respond immediately and call 911. Do not leave the student alone. The school nurse will provide more detailed information, demonstrations, and practice when delegating how to recognize and care for a severe low blood sugar. How to treat a low blood sugar is based on the student's diabetes emergency care plan. Review your handouts: low blood sugar fact sheet, low blood sugar skills checklist, and diabetes emergency care plan. High blood sugar is a high level of sugar in the blood. An isolated high blood sugar reading is cause for concern but not alarm. It is important to know that blood sugar is expected to be higher following a meal or snack. High blood sugar becomes an increasing concern when, number 1, 2 blood sugars in a row have been high, number 2, accompanied by vomiting, or number 3, the student has an insulin pump. The student's individualized healthcare plan will list what actions to take. Causes of high blood sugar can include missed insulin dose, not enough insulin was given for the amount of carbohydrate intake during a meal or snack, insulin pump that is not working properly or has become disconnected, expired insulin or insulin exposed to extreme heat or cold, decreased activity, illness or infection or stress, some medications, and normal variations such as adolescent growth periods and menstrual cycle changes. In extreme cases, the student may develop nausea, vomiting, behavior changes, irregular breathing, and may become unconscious. This is considered a medical emergency. Symptoms of high blood sugar include increased thirst, frequent urination, nausea, blurred vision, fatigue or tiredness, headaches, decreased ability to concentrate and do schoolwork, and behavior changes such as irritability. The school nurse will provide more detailed information, demonstrations, and practice when delegating this task. Stop! How to treat high blood sugar will be taught by your school nurse. Review your handouts. High blood sugar fact sheet, high blood sugar skills checklist. The body needs energy. When the body cannot get energy from sugar, the body will break down fats. When fat is broken down to be used for energy, acids called ketones are formed. When fats are broken down, ketones can be found in the blood and in the urine. Ketones cause the blood to be too acidic. Too much acid in the blood is toxic or poisonous. Keeping ketone levels in check is an important part of managing diabetes. The student's diabetes medical management plan will specify when the students should check their blood or urine for ketones. Generally, ketones are checked when blood sugar levels are above 300 and when the student doesn't feel well or is vomiting. Students with pumps will have special guidelines for when to check for ketones. Diabetic ketoacidosis, or DKA, is a very high level of ketones in the blood. It is a medical emergency. A student with diabetes can become very ill from too many ketones. Ketones can cause stomach pain, cramps, nausea, and vomiting. A person may think they have the stomach flu when they are becoming sick from high ketones. As the ketones build up, the body tries to get rid of them. One way is through the lungs by breathing hard and fast. The ketones can cause a fruity smell on the breath. If the student has any of these symptoms, notify the school nurse and parent or guardian immediately. The school nurse will provide more detailed information, demonstrations, and practice when delegating this task. How to perform ketone checks will be checked by your school nurse. Review your handouts. Procedures for blood and urine ketone monitoring. Blood and urine ketone monitoring skills checklist. Why do we count carbohydrates? Food provides the body with proteins, fat, and carbohydrates. The body uses food in different ways. Protein builds muscle, fat is used in energy storage, and carbohydrates provide energy for the body. Carbohydrates raise the blood sugar. About 90 to 100% of carbohydrates become sugar in the body in the first 1 to 2 hours after eating. When do we count carbohydrates? Carbohydrates are counted when figuring insulin amounts. Proteins and fats do not affect the blood sugar as much, so they are not counted. Carbohydrates are found in bread, pasta, cereal, corn, potatoes, tortillas, fruit, milk, and sweets. Insulin doses are calculated on the total amount of carbohydrates eaten in a snack or meal. This is known as carb counting. The school nurse will provide more detailed information, demonstrations, and practice when delegating this task. How to perform carbohydrate counting will be taught by your school nurse. Review your handouts. How to count carbohydrates, and practice adding up carbohydrate amounts for meals with your school nurse. Insulin is given to students with diabetes because their body cannot make insulin. The goal of insulin therapy is to maintain blood sugar levels in a target range. How and when to give insulin will vary from student to student. In the Diabetes Medical Management Plan, the student's healthcare provider gives instructions about the type of insulin to be given, when, and how to give. Too much insulin will cause low blood sugar. This is life-threatening. Too little insulin will cause high blood sugar. Students take their insulin in different ways. Insulin can be delivered to the body with an insulin syringe, insulin pen, or insulin pump. Parents or guardians provide the insulin and supplies necessary to give insulin at school. An insulin syringe is used to draw up and give the correct amount of insulin from a bottle. Review your handouts. Insulin fact sheet, procedure for insulin administration by syringe, insulin administration syringe skills checklist. The school nurse will provide more detailed information, demonstrations, and practice when delegating this task. An insulin pen looks like a fountain pen. The pen holds a cartridge of insulin and a needle is screwed on the pen's tip just before giving the insulin. The selected amount of insulin is dialed on the pen. Review your handouts. Insulin fact sheet, procedure for insulin administration by pen, insulin administration pen device skills checklist. The school nurse will provide more detailed information, demonstrations, and practice when delegating this task. An insulin pump is an electronic device about the size and weight of a pager. It is worn outside the body and is continuously connected to the student. It delivers small amounts of short-acting insulin all through the day. It is programmed to deliver the insulin through a plastic tube called an infusion set. The infusion set is inserted with a needle just beneath the skin. The small needle or plastic cannula stays in place for 2 to 3 days, and then a new infusion set is placed on a different site or place on the body. The insulin pump delivers rapid-acting insulin, simulates normal insulin delivery, delivers small amounts of insulin continuously to cover insulin needed for body functions, can deliver a bolus of insulin all at once, like taking a shot, when carbohydrates are eaten or the blood sugar is high. Pumps are mechanical devices that can fail. All students will have a plan in the event of a pump failure. Call the school nurse immediately if any of these occur. The pump fails mechanically, the cannula or needle is pulled out, or the tubing is cut, clogged, or bent. If the pump fails for any reason, the supply of insulin is stopped and the blood sugar level will rise rapidly. Review your handouts. Insulin pump fact sheet, procedure for insulin pump therapy for the student who can independently manage their care, procedure for insulin pump therapy for student requiring supervision to manage their care, insulin pump therapy skills checklist. Glucagon is a hormone in the body that causes the liver to release stored sugar. When stored sugar is released from the liver, blood sugar levels rise. A glucagon shot is given when the blood sugar is so low a person is unable to eat or drink sugar to increase the blood sugar level. A glucagon shot is given when the student is unconscious, having a seizure, not able to swallow, or combative. The glucagon shot is an emergency medicine given for quick sugar. The blood sugar is so low that the brain is affected. After giving a glucagon shot, turn the student on his or her side. Sometimes glucagon can cause vomiting. It will take 10 to 15 minutes for the person to wake up. Call 911, the parents, and the school nurse when glucagon is given. The school nurse will provide more detailed information, demonstrations, and practice when delegating this task. How to perform a glucagon shot will be taught by your school nurse. Review your handouts. Glucagon fact sheet, procedure for glucagon injection, glucagon administration skills checklist.